Pelé is dead. The king is no more. To many, the greatest footballer of all time is sadly no more. But how did he pass away? What was his cause of death? Why did someone who looked after his health so well decline in the past 12 months? Was his death preventable at all? And what are some signs you can look out for in your own body to detect cancer? Hi, welcome back to the channel. My name is Dr Aziz. I'm a physician based in the UK. In this video, I'll be covering the decline and death of possibly the greatest footballer of all time, Pelé. Pelé is really someone who needs no introduction. Until Ronaldo and Messi came onto the scene, Pelé was talked about along with Diego Maradona as the greatest footballer of all time. During his international career, he won 3 World Cups, 1958, 1962 and 1970, until today the only player in history to do so. In 2000, Pelé was voted World Player of the Century by the International Federation of Football History and Statistics and was one of the 2 joint winners of the FIFA Player of the Century, an award really Diego Maradona won, but which was ultimately shared with Pelé. Pelé scored a staggering 1,279 goals in 1,363 games in his career. This is a recognized Guinness World Record, and that's nearly a goal a game. In late 2021, Pelé was diagnosed with bowel cancer, also known as colorectal cancer, and there was much concern and conflicting information since then about how serious his condition was until he passed away yesterday. In this video, we will cover, as always in jargon-free language, what bowel cancer is, what are the signs and symptoms of bowel cancer, when you should seek medical help, and whether bowel cancer is treatable or not. What is the bowel? When you eat food, it goes from your mouth all the way in one long pipe to your back passage where it eventually exits as poo. Along the way, there are various other parts such as the food pipe, medically known as the esophagus, then the stomach, which we all know about and happily fill every day, and then we have the bowel, basically the part between the stomach and the back passage. The bowel is also split up into the small bowel and the large bowel. In this part of the body, there is a lot of mixing of food, absorption of various nutrients, mixing with water, and formation of stool or poo. What is bowel cancer? Bowel cancer is a general term for cancer that begins predominantly in the large bowel. Depending on where the cancer starts, bowel cancer is sometimes called colon or rectal cancer or colorectal cancer. Bowel cancer is one of the most common types of cancer diagnosed in the world. Most people diagnosed with it are over the age of 60. What causes bowel cancer? The exact cause of bowel cancer is unknown. However, research has shown several factors may make you more likely to develop it. These include older age, family history, diet, including a diet high in red and processed meat, low fiber in the diet, smoking, alcohol, obesity, and there are some genetic and bowel disorders such as Crohn's and ulcerative colitis which can predispose you to bowel cancer. What are the symptoms of bowel cancer? More than 90% of people with bowel cancer have one of the following combination of symptoms: a persistent change in bowel habit, i.e. pooing more often with looser, runnier poos, and sometimes abdominal pain, blood in the poo, abdominal pain, discomfort or bloating, all is brought on by eating, sometimes resulting in a reduction in the amount of food eaten, and weight loss. Diagnosis of bowel cancer. The 2 main methods of diagnosing bowel cancer is number 1, via colonoscopy. This is a camera test of your bowel via the back passage. If anything suspicious is seen, biopsies are taken and analyzed. Number 2, a CT scan of the abdomen. This is a detailed scan of your abdominal area. Treatment of bowel cancer. Treatment for bowel cancer will depend on which part of your bowel is affected and how far the cancer has spread. Surgery is usually the main treatment for bowel cancer and may be combined with chemotherapy, radiotherapy or biological treatments depending on your particular case. If it is detected early enough, treatment can cure bowel cancer and stop it coming back. Unfortunately, sometimes a complete cure is not always possible and there are sometimes a risk that the cancer could come back at a later stage. A cure is highly unlikely in more advanced cases that cannot be removed completely by surgery, but symptoms can be controlled and the spread of cancer can be slowed using a combination of treatment. Stages of bowel cancer and prognosis. As with other cancers, there are different stages, and also the prognosis, i.e. how long someone is expected to live, is based on these stages. Now, what we use in the medical field for prognosis is sometimes called the 5-year survival rate, meaning what percentage of people are expected to live a particular stage of cancer in 5 years' time. I'll give examples in a second and it will become more clear. The 4 main stages are stage 1. The bowel cancer is still contained within the lining of the bowel or rectum. Around 90% of stage 1 bowel cancer will survive their cancer for 5 years or more after they are diagnosed. Stage 2, the cancer has spread beyond the layer of muscle surrounding the bowel and may have entered the surface covering the bowel or nearby organ. In this stage, around 80% will survive their cancer for 5 years or more. Stage 3, The cancer spread into nearby lymph nodes. Lymph nodes are part of the body's immune system, but cancer cells can invade them and spread. Around 70% with stage 3 bowel cancer will survive the cancer for 5 years or more after they are diagnosed. And stage 4, the cancer has spread beyond the bowel into another part of the body, such as the liver. Around only 10% with stage 4 bowel cancer will survive the cancer for 5 years or more after they are diagnosed. So let's come back to the great Pelé. That Pelé had a diagnosis of bowel cancer was confirmed in 2021. For a long time, however, neither his medical team nor family confirmed nor denied the fact that his cancer has spread. Various Brazilian newspaper reports, however, stated that his cancer had spread to the liver and lung, and others stated that he had actually stopped responding to treatment and that he was now in palliative care. Palliative care, sometimes known as end-of-life care, is where we basically decide to stop actively treat a patient for their cancer, but rather focus on keeping the patient comfortable and help them with their symptoms. Peles death was confirmed by his manager Joe Fraga at the hospital Albert Einstein in Sao Paulo in Brazil. He said the cause was multiple organ failure, the result of progression of colon cancer. Essentially, the cancer spreads and destroys the liver, kidneys, lungs, eats away at the body until the heart can no longer cope with the demands of a severely diminished body and ultimately stop. Pelé had entered the hospital several weeks ago for treatment of a variety of health issues, including a respiratory infection. As mentioned previously in other videos, it is very often an infection that lands a knockout blow. As was Pelé's spirit, it seemed he went in fighting to the end, but ultimately every soul has to taste death, and no medicine or technology can prevent that once a man's time has come. Could Pelé have been saved? To answer the earlier question of could Pelé have been saved, it really comes down to whether signs and symptoms were ignored or missed. Did he have bleeding from the back passage? Was there an unexplained weight loss? Was there a change in bowel habit? Was there abdominal pain? And so forth. Sadly, in some cases, the cancer has spread by the time these symptoms are noted or investigated. It's difficult to say regarding Pelé's scenario, given that his family closely guarded his health and cancer status right to the end. Anyway, I hope you found that explanation useful. If there is anything you want clarification on, do post down below. What are your memories of Pelé? Do you believe he was the greatest player of all time? How does he compare to Maradona, Ronaldo and Messi? Do post your memories or thoughts down below. Anyway, I hope you learned something useful. Remember the possible signs of bowel cancer: blood in the poo, persistent abdominal pain and change in bowel habit. If any of these should occur, go and see your doctor. Now mention the great football player and in my opinion the greatest of all time, Diego Maradona, who sadly also died a couple of years ago. His death report will be out soon on this channel. Be sure to watch that and these other autopsy reports, which I'll link for you here. Anyway, I hope you learned something useful and enjoyed this summary. If you want to keep learning about psychology, medicine or life hacks, hit the like, subscribe and notifications button. Any suggestions or comments, feel free to post below. Until next time, stay safe.